Okay, so now you understand that in order to experience aerobic adaptations and improvements in aerobic power, your training must impose sufficient and frequent stress, and that stress is experienced during post anaerobic threshold exercise. So, what types of training would be optimal for improving aerobic power and thus endurance? Well, generally, training can be described based on the relationship to the anaerobic threshold. So, pre anaerobic training is steady state training, meaning you can sustain the level of intensity continuously for a prolonged duration because there is no fatigue. So, far below the anaerobic threshold intensity, you have low intensity steady state training. And low intensity here is about 40 to 50% VO2 max or heart rate max. Now, keep in mind the workload at a particular intensity is relative to the individual. For example, 50% VO2 max intensity for you may be a 5 mile per hour jog, while 50% VO2 max intensity is a 2 mile per hour walk for another less fit individual. So please keep that in mind. Next, you have moderate intensity steady state training, which is roughly about 50 to 60% VO2 max or heart rate max. And again, this is steady state because you are still way below your anaerobic threshold. This is not fatiguing exercise. Then you get to intensity right below or at your anaerobic threshold. This is on average about 60 to 70% VO2 max or heart rate max. Now, of course, the anaerobic threshold intensity differs among individuals, but this is just an average figure here. Now, again, this is referred to as high intensity steady state training. The exercise bouts are still steady state because it is not exceeding the anaerobic threshold, but you do have some metabolic stress to your muscles at these intensities. Now, as you train above your anaerobic threshold, the exercise bouts go from steady state to intervals. Why? Because since the exercise bout is above the anaerobic threshold intensity, it is not sustainable due to the presence of hypoxia and thus fatigue. Therefore, the exercise bout is split into post-anaerobic threshold intervals of exercise, separated by intervals of rest, or pre-anaerobic threshold exercise as a recovery interval. So right above the anaerobic threshold intensity, you have high intensity interval training, or HIIT training as most of you refer to it as. And this type of training involves exercise intensities at around 70 to 80% VO2 max, which for the average individuals is slightly above the anaerobic threshold. Again, these relative intensities differ among individuals depending on the level of fitness. I'm just presenting norm values here, in other words. Also, keep in mind, I will not ask questions on the exam regarding the relative intensity as a percentage of VO2 max or heart rate max for each of these training modes, since again, it is all relative to the individual. So as you get further above the anaerobic threshold and closer to maximum intensity and thus closer to your VO2 max or aerobic capacity, you have max effort interval training, otherwise known as sprint interval training. This type of training incorporates exercise bouts at a relative intensity of 90 to 100% VO2 max or heart rate max. So basically, it is all-out efforts during the exercise intervals. Now, the exercise intervals within sprint interval training bouts would obviously be shorter compared to high-intensity interval training because they are much more fatiguing. Now, as shown in the studies presented in the previous slides, sprint intervals can be anywhere from 10 to 30 seconds, followed by a rest or low-intensity interval, usually around 5 minutes. So with everything that has been discussed thus far regarding the fundamentals of training adaptations, which of the training modes listed here would be optimum for aerobic adaptations and improvement in aerobic power? It would be the training modes that are at or above the anaerobic threshold, so anaerobic threshold or post-anaerobic threshold exercise bouts. These training modes, since they are at or above the anaerobic threshold, involve frequent exposures to hypoxic stress to the muscles involved, and thus there is a stimulus for change, for adaptations, which are collectively referred to as aerobic adaptations. Now, many people believe that in order to be more aerobically fit, you need to do low intensity steady state to moderate intensity steady state, super long duration exercise bouts. However, that is not the most optimum approach because there is low exposure to hypoxic stress to the muscles, and thus the stimulus for adaptation is minimal. So to improve endurance and thus fatigue resistance by aerobic adaptations, you must train at or above your anaerobic threshold intensity, And as you get in better shape, you must adjust your workloads so that you stay at or above your anaerobic threshold. For instance, say your anaerobic threshold at pre-training was at a workload of 6 miles per hour. You performed high-intensity interval training with an average workload of 8 miles per hour for 4 months, and your anaerobic threshold improved to a workload of 9 miles per hour. So now the 8 mile per hour workload is insufficient for high-intensity interval training because it is now a pre-anaerobic threshold workload, and it is too easy, in other words. It does not impose much stress anymore, and thus you won't adapt further and experience further improvements. So what do? Well, you adjust your HIIT workload to say 10 miles per hour so you are staying above your anaerobic threshold workload of 9 miles per hour. This is a simple example of progressive overload. So what do I mean by progressive overload? The concept of progressive overload and why it is necessary to experience continual adaptations and improvements is based on the general adaptation syndrome. The general adaptation syndrome describes the stages that an organism, like a human being, undergoes when exposed to a new stressor, such as exercise, and the changes that occur when that stressor is frequently imposed on the body. So as I emphasized earlier, the most important aspect of endurance training to improve muscular endurance is to train at or above a post-anaerobic threshold intensity or workload. The reason for this is because only during these intensities would there be an appropriate stressor to elicit adaptations for the ultimate purpose of increasing aerobic power and muscular endurance. So what is that stressor associated with post-anaerobic threshold exercise intensities or workloads? It is the hypoxic stress that we discussed in part 1 that causes acute muscular fatigue. Remember, the presence of acute muscular fatigue is an indication that there is a stressor present, since fatigue is the acute stress relief response. Fatigue is again a muscle self-inhibition for the purpose of relieving itself from this hypoxic stress by reducing the ATP demand from the aerobic systems and thus the oxygen demand. So remember, the adaptations are specific to the stressor because the whole purpose of adaptations is to minimize the stress from that stressor. So what type of adaptations will reduce the hypoxic stress and thus the fatigue associated with a particular workload that was once a post-anaerobic threshold workload? Adaptations that would improve the oxygen availability in the muscle, as well as adaptations that improve the aerobic system's ATP producing power. I am alluding to enhancements in the cardiovascular system as well as the muscle itself. More on this later. These adaptations would reduce the hypoxic stress and thus less fatigue would occur at a workload that used to be hypoxic and fatiguing. So as an individual begins a training regimen, they undergo stages leading to aerobic adaptations and thus improvements in muscular endurance as defined earlier. First, we have the alarm phase. During this stage, the first few exercise bouts that is at or above the anaerobic threshold is performed. These first few exercise bouts are at intensities that the individual is not accustomed to. Thus, these initial exercise bouts will induce what we call an overload stress. An overload stress is referring to that hypoxic stress associated with the post-anaerobic threshold exercise workload. Now, because the individual is not accustomed to this stress yet, meaning they have not adapted to this stress obviously causes fatigue and a temporary decrease in performance. This temporary decline in performance is referred to as shock and can be characterized with increased muscle damage, prolonged central and peripheral fatigue, and may require active recovery strategies. Now, naturally, as you continue your training at that particular intensity or workload, the body begins to adapt to it, first by compensation, which is essentially bringing your body back to baseline levels. At this point, no positive net gains have been achieved. As you continue your training and impose that overload stress continuously and frequently, your body will continue to adapt and eventually undergo what we call supercompensation, which describes the phase when adaptations have resulted in improved muscular endurance. And the workload that elicited the overload stress here is now less stressful and thus less fatiguing. It becomes easier, in other words. As you can see here, compensation and supercompensation is within the adaptation stage. So just to recap, if I asked, when a particular post-anaerobic threshold workload becomes less fatiguing and sustainable for a longer period, which of the following has occurred? If one of the answer choices is supercompensation, that would be the correct answer. Now, as the individual adapts and supercompensates, there will be a point when the adaptations sufficiently overcome the initial overload stress associated with your initial training workload. At this point, the overload stress is no longer an overload stress because you have adapted to it and have become accustomed to it. You got used to it, in other words. At this point, therefore, the exercise workload that once elicited this overload stress now does not elicit an overload stress, meaning it is too quote-unquote easy and does not provide much hypoxic stress and is not fatiguing. At this point, supercompensation stops, meaning adaptations no longer occur because that exercise workload does not provide enough stress to stimulate further adaptations. You could say that the hypoxic stress of a particular workload will diminish as you adapt to it. That is the whole point of adaptations after all. Now, this point when supercompensation or adaptation ceases is called the plateau stage. So to summarize a plateau, it is simply a situation in which the initial training workload that used to elicit an overload stress no longer provides a sufficient stress to stimulate further adaptations, to stimulate further supercompensation. Simply put, a plateau means you have sufficiently adapted to the initial training workload. And you have to understand that every athlete that undergoes training will experience this plateau stage. And it is the quality of the training program that will determine whether the athlete continues to adapt and therefore improve muscular endurance further. Now, from a conceptual standpoint, we know that in order to stimulate further adaptations, we need a new overload stress. The workload that elicited the initial overload stress for the initial adaptations or supercompensation is now no longer adequate to stimulate adaptation. And thus, something needs to be modified in the training so that an overload stress can be imposed on the body. This usually is achieved by simply increasing the exercise workload. So, for example, if a 5-mile-per-hour run workload caused the initial overload stress for the initial adaptations, and you have adequately adapted to that 5-mile-per-hour workload, and further improvements in muscular endurance have stopped, you would increase that workload to say 8 miles per hour so that you can reintroduce a new overload stress to stimulate further adaptations and improvements in muscular endurance. Now, many athletes who have poor training programs without any consideration of the general adaptation syndrome and without any progressive modifications may undergo a prolonged period of plateau, which is referred to as stagnation. And this could also lead into a decline in performance, which is referred to as overtraining. Now, a program that incorporates modifications to introduce new overload stress in a timely manner to avoid stagnation is described as a periodized program. Periodization simply means that there are intentional, systematic modifications placed within the program to maximize adaptations. So as a new overload stress is imposed by progressively modifying the training program, for example, by increasing the training load from 5 miles per hour to 8 miles per hour, you would experience a new shock, just like you did initially when you were not accustomed to that 5 mile per hour run. This would lead to compensation, followed by supercompensation, and further improvements in muscular endurance. As you sufficiently adapt to this new 8 mile per hour workload, you would eventually experience another plateau, as you see here. And at this point, further progressive modifications must be implemented, like a further increase in exercise workload. Now, this concept of applying progressive modifications is referred to as progressive overload. The term overload is referring to the overload stress. Without an overload stress, there is no reason or stimulus for adaptation. And so as you adapt to an initial overload stress, you need to apply progressive modifications to continue to impose overload stress to the body, to elicit continual adaptations and therefore improvements in muscular endurance. Now, this here is a training week of a sample conditioning program that incorporates exercise at or above the anaerobic threshold. Now, on Monday, you have your sprint interval training, which is small in volume but very high in intensity. On Wednesday, you have your high intensity steady state exercise, which is right at your anaerobic threshold or just below your anaerobic threshold. This again is the maximum steady state intensity, meaning the maximum intensity that you can sustain without fatigue. On Friday, you have your high intensity interval training bout, which incorporates intervals at intensities above your anaerobic threshold, but just slightly below your max intensity. You see, in this example, there's quite a bit of variation here, and this would be more appropriate for someone who is well trained as opposed to someone who is a novice or has been previously sedentary. But this is just an example of how a training week would look like in a periodized conditioning program. And as you adapt to these stressors imposed week after week after week, and these training bouts become essentially less stressful, you have to apply progressive overload to your training program to experience continual adaptations and improvements in muscular endurance. All right, so as I discussed, the training modes that are at and above the anaerobic threshold, as listed as these three right here, are the training modes that will elicit the appropriate overload stress required for adaptations. But what about the pre-anaerobic threshold training workloads or intensities? Does a low to moderate intensity steady state training elicit aerobic adaptations and improve aerobic power? The answer to this is yes. These pre-anaerobic threshold training modes can improve aerobic power, but to a limited extent, and I do mean limited extent, and only if it is sufficient in duration. Meaning a 30-minute low-intensity bout a few times a week will not induce significant adaptations, if any. For example, if you are a pretty well-trained individual and say your maximum steady-state running speed is 10 miles per hour, meaning 10 miles per hour is your anaerobic threshold workload, walking at 2 miles per hour for 30 minutes 3 times a week is not going to cause any improvements in aerobic power because there is no overload stressor. In fact, exercising at these lower workloads would likely cause de-adaptations and lower your anaerobic threshold. But what if you were doing a 2 mile per hour hike for 5 to 6 hours, say 3 times a week? Could this then help improve aerobic power? Possibly yes, but again to a limited extent. There is a reason why these low intensity workloads need to be performed for a prolonged duration to elicit some adaptations. And that is because fuel depletion is a stimulus for adaptation among other stimuli. So since low to moderate intensity steady state exercise depletes fuel, particularly muscle glycogen, at a comparatively low rate, it would take a longer period to have sufficient depletion. Now keep in mind that fuel depletion is only one of the many stimuli for adaptations, which we will discuss in detail in a few moments. Many of the stimuli for aerobic adaptations are not present with low to moderate intensity steady state exercise, as they are more associated with the hypoxic stress that occurs with post-anaerobic threshold exercise. But fuel depletion is one stimuli that is still possible with low to moderate intensity steady state exercise as long as it is prolonged in duration. So yes, if you are performing low to moderate steady state intensities and expect to experience increases in aerobic power or fitness, these exercise bouts need to be very prolonged, which can be impractical for many people. Many of us don't have hours within the day to exercise. As a concluding statement for exercise programming, anaerobic threshold to post-anaerobic threshold training modes would be the most optimal for improving muscular endurance. So for example, in those elite marathoners we introduced earlier, that 13.1 mile per hour workload was right below their anaerobic threshold. That means these marathoners would not benefit much from training at a workload at, like, say, 5 miles per hour, for example. 5 mile per hour training wouldn't be training at all for them since it would not cause enough stress or overload stress to stimulate any kind of adaptations. Now, as far as practical conditioning program principles are concerned, the number one factor is stress, particularly overload stress. Stress is why we adapt. More specifically, frequent stress. So if your training program does not impose that hypoxic stress associated with the post-anaerobic threshold workload frequently, then there will be no adaptations. There will be no supercompensation because an overload stress is required for that to occur. Now we have to understand that the desired adaptations is specific to the stress. So in the case of improving muscular endurance and thus fatigue resistance, adaptations such as improved oxygen availability and mitochondrial power are adaptations specific to reducing the stress of hypoxia associated with the given workload or intensity. These adaptations again will be discussed shortly in much more detail, but just know for now that the improvement in aerobic power, which again is improved anaerobic threshold and aerobic capacity, is a result of adaptations that occur to deal with this hypoxic stress of a particular exercise workload. This means that endurance training is really anaerobic threshold training or post-anaerobic threshold training, meaning training using workloads at or above your anaerobic threshold is how you introduce the specific stress to improve aerobic power to improve muscular endurance. This means that in order to effectively impose the appropriate stress to the body, you need to know what your anaerobic threshold is. In other words, you need to know your anaerobic threshold intensity, such as a percent of your max heart rate, or anaerobic threshold workload, like running speed or cycling power, that is at your anaerobic threshold. Now, as indicated here, random training intensity selection will lead to random outcomes, meaning if you select intensities without knowing where it is in relation to the anaerobic threshold, you wouldn't know what outcomes to expect. There are plenty of people who do high-intensity interval training, but their high-intensity intervals are pre-anaerobic threshold intensities. They just don't know it because they don't know what their anaerobic threshold intensity is. This means data on the individual's aerobic power, which again include aerobic capacity and anaerobic threshold, would be critical for training programming and intensity selection. So for aerobic capacity, we said the measurement is VO2 max, maximum oxygen consumption rate. However, VO2 max is not easily measured because it requires equipment, lab equipment. You need to perform a graded maximal exercise test while hooked up to a metabolic cart that measures VO2 to test your VO2 max. This means you need access to lab equipment, which most of us don't have. There are, however, procedures, more specifically field testing procedures, that allow you to predict VO2 max using heart rate instead, since heart rate and VO2 have a direct relationship. Many of the new heart rate monitoring technologies have algorithms to predict VO2 max and changes in VO2 max, but the reliability and accuracy of these devices are always in debate. As I emphasized earlier, the anaerobic threshold is one of the most critical factors of aerobic power. I mentioned that the two measurements of anaerobic threshold is the lactate and ventilatory thresholds. The lactate and ventilatory threshold tests are performed during a maximal graded exercise test. This test requires you to exercise, usually running or cycling, at multiple stages of increasing intensity. Lactate or ventilation will be measured at each stage, and eventually, as you increase intensity, lactate and ventilation will increase exponentially, marking the point at which the aerobic system requires anaerobic backup because the oxygen availability and the mitochondrial power is insufficient to fulfill the full ATP demand. This is when fast glycolysis, your anaerobic system, increases in activity and thus lactate production increases. This is when acute metabolic acidosis increases and ventilation increases to activate the bicarbonate buffering system. Thus, this is the point at your anaerobic threshold, and the intensity as a percent of heart rate max or VO2 max at your anaerobic threshold can be determined. Now, as you can tell, lactate and ventilatory threshold testing can also be impractical and requires equipment. Lactate threshold testing is also invasive as blood draws are required. However, knowing the intensity as a percentage of heart rate max, for example, at which your anaerobic threshold is observed, can be very useful if you want to train with multiple modes of exercise. For example, if your anaerobic threshold intensity is at 80% your heart rate max, you can apply this in cycling, swimming, rowing, running, circuit training, etc. to determine the training intensity for each of these modes, as long as you can monitor heart rate. But what if you are just a single mode athlete who just cycles, for example? Is there another more practical route to anaerobic threshold testing? What if there is a test where you could simply determine the workload, such as cycling power, at which your anaerobic threshold is observed? In other words, your maximal steady state workload, the maximum workload you can sustain without fatigue. Luckily, there is such a test, and this is called the 3-minute all-out test. This test, as the name implies, is an all-out effort test, just like that Wingate test, to determine the maximal steady state workload, also known as critical workload or critical power if the measurement of workload is power. This is your anaerobic threshold workload. When you figure out your critical workload, then you can determine the appropriate training workloads. Again, this is specific to the mode of exercise or task. So if you determine your critical cycling power using the 3-minute all-out test, you can't apply this to running or rowing. You would have to do the 3-minute all-out test for each mode of exercise to determine the anaerobic threshold workload for each mode. Now, this testing protocol has been recently popularized for athletes because it is simple and a practical way to determine the anaerobic threshold workload for a particular exercise mode. It also doesn't require hefty lab equipment. So let's go ahead and discuss the concept underlying the 3-minute all-out test. The 3-minute all-out test is based on the concept that when you perform exercise with a post-anaerobic threshold workload, fatigue will slow your muscles down to a workload that is slightly below your anaerobic threshold to reduce the hypoxic stress. Therefore, fatigue will essentially force you to bring your workload down to one that is without hypoxic stress and thus sustainable. During the test, the subject will cycle, run, or row at maximal effort for 3 minutes straight. Within about the first 150 seconds, depending on the subject, fatigue will bring the workload or power output down to the point that is not hypoxic. It will bring you down to a workload that can be performed at steady state, right below your anaerobic threshold workload. This again is referred to as your maximal steady state workload or critical workload / power. For this procedure, the average workload or power within the last 30 seconds of the test is used to calculate the maximal steady state workload, aka critical workload, aka workload at the anaerobic threshold. So let's say this is for cycling. The subject will be cycling with maximal effort and will ramp up the cycling power output to say 800 watts, which would be peak power. As you can imagine, the subject would not be able to sustain peak power for very long because of fatigue, caused by the severe hypoxic stress associated with maximal intensity exercise. So due to fatigue, the power output will decline. It will decline to a power output to say 300 watts. And this power output is sustained for the remainder of the test, even with maximal effort. So whatever the average power output within that last 30 seconds of this test is, that will be considered your maximal steady state power or workload, again also known as critical power. Now let's just say, for example, 300 watts was the maximal steady state power, and thus 300 watts is the workload at which your anaerobic threshold is observed. This means that if you're going to do high intensity steady state training, your workload should be around 300 watts. If you're going to do high intensity interval training, your workload for your high intensity interval should be, say, 600 watts. And for sprint interval training, your workload for your max intensity intervals would be your peak power, which is about 800 watts. Now you can apply this protocol to other modes of exercise as well, such as running and rowing, and this protocol is practical and can be done with minimal equipment. So to summarize, the concept of the 3-minute all-out test is for an individual to exercise at maximum all-out effort, so at maximal intensity. And acute muscular fatigue caused by the severe hypoxic stress will force that individual to reduce his or her workload all the way down to a workload that is slightly below the anaerobic threshold. And this will occur towards the end of the test. And that last 30 seconds of that test, the average power within that time frame will be used to determine critical power, the maximal steady state power output or workload. Now, moving forward, let's go ahead and continue our discussion on endurance training adaptations, answering the question of what explains improved aerobic power with endurance training, meaning what is physiologically occurring that improves anaerobic threshold and aerobic capacity with training. First of all, many attribute the improvements in anaerobic power or fitness to changes in the cardiovascular system, and this is why conditioning is often referred to simply as cardio. In our exercise physiology course, we talked about the cardiovascular adaptations to endurance training, and these adaptations function overall to improve oxygen supply to muscles at a higher rate during exercise. But the thing is, it's not all about cardiovascular adaptations. That's only one piece of the puzzle. Conditioning or endurance training improves aerobic power, which again is an increase in anaerobic threshold and aerobic capacity, through multiple mechanisms, both in the cardiovascular system as well as in the skeletal muscle itself. This is why earlier I indicated that the adaptations to endurance training that contribute to improved aerobic power is a function of a multi-organ system adaptation. This is why we can compartmentalize the underlying mechanisms or adaptations to endurance training as cardiovascular adaptations and metabolic adaptations, all leading to improved aerobic power and thus muscular endurance or performance. Now, everything under cardiovascular adaptations we discussed in our exercise physiology course, so we're not going to spend too much time in this lecture series going over the details concerning the cardiovascular adaptations to endurance training. Briefly, as a result of endurance training and the frequent hypoxic stress imposed on the body, there is an increase in maximal cardiac output, which is the maximum rate of oxygenated blood flow pumping out from the heart. There is also an increase in muscle capillary density. If you remember your basic anatomy, capillaries are microvessels where oxygen exchange occurs between the blood and the tissues, like muscle. Finally, you have increased oxygen carrying capacity in blood and increased oxygen extraction by muscle. Now, altogether, these individual cardiovascular adaptations improve oxygen availability. This would contribute to an increase in aerobic power directly and also indirectly by increasing the ATP producing power of the mitochondria, which, as you know, is where aerobic metabolism occurs. Now, take careful note of this. These cardiovascular adaptations and the resulting increased oxygen availability enhances aerobic power specifically through the enhancement of VO2 max, or in other words, aerobic capacity, meaning the cardiovascular adaptations primarily impact aerobic capacity, which is again measured by VO2 max. And this should make sense because the cardiovascular adaptation increases oxygen availability for muscle. In other words, it increases the maximum oxygen consumption in muscle, which is measured by VO2 max. So if I ask the question, in which of the following ways do the cardiovascular adaptations to endurance training improve aerobic power, the answer would be an increase in aerobic capacity, which can also be stated as an increase in VO2 max. This means the cardiovascular adaptations to endurance training have only minimal impact on the other factor of aerobic power, which is anaerobic threshold. It doesn't mean it has zero impact on anaerobic threshold, it just means it has a little impact on anaerobic threshold. So what about the other side of this figure? Metabolic adaptations refer to the adaptations that occur in the skeletal muscle itself. So the skeletal muscle adaptations to endurance training are collectively referred to as metabolic adaptations, and they usually occur concurrently with the cardiovascular adaptations during training. Now again, these metabolic adaptations are changes that the skeletal muscles that are being trained are undergoing, leading to improvements in aerobic power. Now keep in mind, under metabolic adaptations, I have three major specific adaptations that occur. But just understand that there are multiple changes or adaptations that occur within the muscle in response to training. Arguably, the primary and most impactful metabolic adaptation to endurance training is mitochondrial biogenesis. And just like the term implies, this is a process of forming new mitochondria within the skeletal muscle cells, which we know is the powerhouse of the cell where aerobic ATP production occurs. So without overthinking it, if mitochondria are the aerobic powerhouses of the muscle cell, how would forming more mitochondria and increasing the overall number or quantity of mitochondria within the muscle cells impact aerobic power of the muscle cells? It would obviously improve aerobic power. Accompanying mitochondrial biogenesis is also an increase in mitochondrial size and density. However, we typically describe mitochondrial genesis as not only an increase in the number of mitochondria, but also in the size and density of each mitochondria, because all three of these outcomes occur together. So overall, mitochondrial biogenesis increases mitochondrial power, quote unquote, which is alluding to the ATP producing power of the mitochondria overall. And this improvement in the mitochondrial quote unquote power would directly improve aerobic power. Now, we will emphasize this further in the following slide, but mitochondrial biogenesis impacts aerobic power primarily by increasing anaerobic threshold and has just some impact on VO2 max or aerobic capacity. So if I asked on the exam which of the following factors of aerobic power is impacted most by mitochondrial biogenesis, the answer would be anaerobic threshold. Some other metabolic adaptations in skeletal muscle in response to endurance training include fuel supercompensation and buffering capacity. Now let's talk about fuel supercompensation briefly. Now remember, the term supercompensation simply just means more than what you had before. So fuel supercompensation is simply having more fuel stored and available in muscle. It is essentially the process of increasing the fuel tank within skeletal muscle cells. So what fuel molecules are we talking about? We are mainly talking about muscle glycogen, which is a stored carbohydrate molecule, and this is the muscle's most versatile and primary fuel substrate. If glycogen runs out, performance stops, and this is referred to again as exhaustion. This occurs despite having other fuel molecules available, such as fat or lipids. So increasing the amount of muscle glycogen stored within the skeletal muscle cells would obviously be conducive to performance and muscular endurance. It would also be conducive to aerobic power, but not so much directly as mitochondrial biogenesis. Remember, aerobic ATP production is not only dependent on oxygen availability and mitochondrial power, it is also dependent on fuel availability because you can't produce ATP without fuel. So in addition to glycogen supercompensation in muscle, you also have fat supercompensation in muscle, meaning an increase in intramyocellular fat or lipids. This has very minimal impact on aerobic power, but it can surely contribute to aerobic power because fats can only be oxidized aerobically. Fat supercompensation in muscle may be more beneficial for prolonged bouts of exercise as it can help preserve muscle glycogen. Now, more on this in a few moments. Lastly, we have increased buffering capacity, and this is mainly referring to the intramyocellular buffering system, which is the carnosine buffering system, which we discussed in part 1 of this series. As an adaptation to post-anaerobic threshold training or endurance training, especially at higher intensity, so for example sprint interval training, there is evidence that as an adaptation to frequent exposures to high metabolic acidosis, there is an increase in muscle carnosine levels. Now, this would not have any direct impact on aerobic power, but it can surely impact performance by improving sustainability of workloads slightly above the anaerobic threshold. So altogether, this figure demonstrates the multitude of adaptations, both cardiovascular and metabolic/skeletal muscle, that contribute to improved muscular endurance with training. And as a summary, the cardiovascular adaptation primarily contribute to increased oxygen availability and thus maximum oxygen consumption rate, which means it impacts mainly aerobic capacity as opposed to anaerobic threshold. On the other hand, the primary metabolic adaptation in muscle is mitochondrial biogenesis, which increases the ATP producing power of the mitochondria within muscle cells. This would have a direct impact on aerobic power by improvement of anaerobic threshold, with some impact on aerobic capacity or VO2 max. Now, as indicated earlier, we already discussed the cardiovascular adaptations in your prior exercise physiology course, and thus for the remaining portion of this lecture series, we will focus mainly on the metabolic adaptations, starting with mitochondrial biogenesis, which again is the primary metabolic adaptation to endurance training in muscle. So to reiterate, mitochondrial biogenesis is technically an increase in mitochondria number, but this is accompanied always by an increase in mitochondrial size as well as density. So what connects mitochondrial biogenesis with enhancement in aerobic power? Now, as we know, the mitochondria is the powerhouse of the cell and is where aerobic ATP production occurs. So it's simply an increase in the quantity of mitochondria. This would increase overall aerobic power in the cell because altogether there's increased amount of aerobic enzymes catalyzing aerobic processes such as the Krebs cycle and the electron transport chain. but also in individual mitochondria, there are positive changes which result in both an increase in size and density of the mitochondria. The increased size of individual mitochondria is attributable to simply more stuff inside the mitochondria, and the stuff are important to aerobic metabolism and the overall quote-unquote power of the mitochondria. Now, going along with an increase in mitochondrial size is an increased density of individual mitochondria. This means that within a given volume of mitochondrial space, there's just more stuff packed inside. The main contributor to an increase in mitochondrial density, as we will discuss in the next slide, are these inner membrane folds called the CRISTAE, which is where much of the aerobic ATP production occurs via the electron transport chain. More on this in a minute. So overall, this figure here represents mitochondrial biogenesis. Not only do you see an increase in the number of mitochondria, you see an increased size in the mitochondria and also increased density of the mitochondria. Again, the size increase is attributable to simply more stuff related to aerobic ATP production contained within the mitochondria, thereby making it more powerful. And the increased density is attributable to an increase in the inner membrane folds, which is where most of the aerobic ATP production occurs via the electron transport chain, also improving the power of the mitochondria. So altogether, mitochondrial biogenesis improves overall aerobic ATP production in the muscle cells. This means the cell has the greater ability to process products such as pyruvate from glycolysis, NADH and protons from redox reactions, as well as ADP, inorganic phosphates, and free protons released during ATP hydrolysis. Now in a few moments, I will provide a visual representation of this. But for now, just understand that with an increase in mitochondrial power within each individual muscle cell, there is less stimuli for fatigue at higher workloads, and this is why mitochondrial biogenesis primarily affects the anaerobic threshold. So if a question is presented with these two figures and I ask which of the following contributes to an increase in anaerobic threshold, the answer would be mitochondrial biogenesis. Or I could also ask this question in a more practical scenario. For example, at pre-training, a 10 mile per hour workload was slightly above the anaerobic threshold and thus fatiguing. After months of training, the 10 mile per hour workload is now pre-anaerobic threshold and non-fatiguing. Which of the following adaptations is the primary contributor to this outcome? If one of the answer choices is mitochondrial biogenesis, then that will be the correct answer. Now, if one answer choice was mitochondrial biogenesis, another answer choice was metabolic adaptations, and another choice was an increase in mitochondrial power, then the answer in this case would be all of the above, since all three of those answer choices refer to the same thing. Let's go ahead and discuss a little bit more about mitochondrial density. Remember, mitochondrial density is characterized by an increase in the inner membrane folds, again called the CRISTAE. And this change in CRISTAE in response to training, or rather the stress of training, is referred to as CRISTAE plasticity. Plasticity is a term to just simply describe the ability to adapt. Like I said earlier, the CRISTAE is where most of the aerobic ATP production occurs in the mitochondria via the electron transport chain. And thus, having more CRISTAE in each individual mitochondria is indicative of greater aerobic ATP producing power of each of those mitochondria. We can understand CRISTAE plasticity and how it changes with training by comparing the mitochondria between sedentary subjects and highly endurance trained subjects. Now, in this particular study, researchers obtained muscle biopsies from a group of sedentary obese individuals and a group of individuals that were cross-country skiers. And they compared the muscle mitochondria between these two groups of subjects. And as you can see in the images in the upper right-hand corner, you can see the mitochondria circled in red. Now, this type of analysis is referred to as histology, which is basically the analysis of cells or cellular structures like mitochondria using imaging technologies like a light microscope or electron microscope as used here. So the mitochondria of the sedentary obese individual can be reflective of the state of muscle mitochondria before training, and the mitochondria of the cross-country skier subjects can be reflective of the state of muscle mitochondria after training. Now, obviously, these differences are on an extreme end because you have two groups on the very opposite ends of a training spectrum, but differences you see here between these two groups can provide some visual of what you would experience as you engage in endurance training. Now, if you compare the mitochondria between the two groups, you can clearly see a difference. The lines that you see within the mitochondria are the inner membrane, and you can see that the inner membrane is much more abundant in the cross-country skiers versus the sedentary obese individuals. This means that the mitochondria of the cross-country skiers are significantly more dense than the sedentary obese individuals, and this is attributable to increased CRISTAE density, meaning in the cross-country skiers, there is a greater density of inner membrane folds, which again is where the electron transport chain occurs. And therefore, this increase in CRISTAE density is associated with greater aerobic power. Now, if you focus on the graph to the bottom left, the y-axis represents mitochondrial volume, so essentially the size of the mitochondria. And you can see compared to sedentary individuals, there is significantly greater mitochondrial volume in those who are trained. And part of this increased volume is the increased density of CRISTAE. So how would these changes in the muscle mitochondria affect muscular endurance? How would it affect performance at a particular workload that was once unsustainable because of fatigue? Let's use this figure here that I presented in part 1 to describe the mechanism underlying acute muscular fatigue. Imagine at pre-training, running at 10 miles per hour was a post-anaerobic threshold workload and thus fatiguing. It was a workload that you could not sustain for very long. And this figure represents the state of the muscle during a 10 mile per hour workload. Before you started training, the mitochondria were too quote-unquote weak to handle the stress of this workload. Thus, there was increased proton accumulation leading to acute metabolic acidosis and inorganic phosphate accumulation, both of which lead to the inhibition of muscle contractions and thereby fatigue. Now, after a period of training, we know that one of the major metabolic adaptations is mitochondrial biogenesis, which not only involve an increased number of mitochondria, but more powerful mitochondria reflected by increased CRISTAE density and size of mitochondria. So now, after some period of training, running at 10 miles per hour is a pre-anaerobic threshold workload and non-fatiguing, because now the state of the muscle cells look like this at this 10 mile per hour workload. There is less or no hypoxic stress, and thus no accumulation of protons and inorganic phosphates inhibiting muscle contractions. Why? Well, one reason is because of increased mitochondrial power. They are bigger, greater in number, and more dense because of more CRISTAE density. The muscle mitochondria is now able to reduce the level of proton and inorganic phosphate accumulation during that 10 mile per hour run, and thus the 10 mile per hour workload is less fatiguing. It is now a pre-anaerobic threshold workload because the anaerobic threshold improved with mitochondrial biogenesis. Now, to dive a little bit more into mitochondrial biogenesis, I want to discuss the factors that connect training and the stresses of training to mitochondrial biogenesis. And if you look at this flow chart to the right, you would see certain factors that are associated with training, which again include low to moderate intensity steady state training that is prolonged, high intensity steady state training, which is at or slightly under your anaerobic threshold workload, high intensity interval training, and sprint interval training, which are your training modes that are significantly above your anaerobic threshold. Now, of course, the fundamental stimulus for mitochondrial biogenesis, along with all the other adaptations, is frequent hypoxic stress exposures. But what are other factors associated with this stress during training that stimulate the processes leading to mitochondrial biogenesis? One of the most potent stimuli for mitochondrial biogenesis is muscle glycogen depletion. This means that to optimize adaptation, there needs to be some level of fuel depletion present following each exercise bout. In other words, exercise bouts should have some level of exhaustion. Along with glycogen depletion, other stimuli include increased ADP/AMP levels, which occur with elevated ATP hydrolysis. Others include increased calcium flux, which is associated with muscle contractions that are repeated for a prolonged period. And lastly, increased epinephrine, which is associated with sympathetic activity, which occurs with exercise. Now, all these factors activate a particular enzyme in muscle cells called AMPK, adenosine monophosphate kinase. Thus, each of these four factors are considered upstream effectors of AMPK. AMPK is a multifunctional enzyme that regulates a lot of metabolic processes. But when chronically activated, like during training, AMPK can stimulate increased synthesis of mitochondrial proteins through a specialized molecule called PGC1 alpha. Now, I won't go into too much detail as to what PGC1 alpha is, but just understand that with increased activation of PGC1 alpha from AMPK activation, there's increased synthesis of mitochondrial proteins, which include aerobic enzymes, electron transport chain proteins, and other proteins that are critical for aerobic ATP production. Eventually, with increased mitochondrial protein synthesis, you get mitochondrial biogenesis.